All right. Hi, everyone, and welcome to the show. So my name is Dr. Etuket. I'm the director of TIMNATH Health, where we run a metabolic clinic. We help people lose fat, improve their cardiovascular parameters, things like blood pressure, blood sugar, blood cholesterol, that kind of thing. So help them lose fat, improve their parameters, and then also help them to build muscle, because you want to be lean, you want to be strong, you want to be healthy. So today I have a very exciting guest. His name is Dr. Castro Kisuule, and I shall let him introduce himself. Castro, hi. How are you? How are you doing today?
Hi, Dr. Andrew. I'm well, thank you. Nice
All
to
right.
be
All right.
here.
And the same here. So Castro, can you tell us about yourself? Who are you? What do you do? Where do you work? And that kind of thing. Yeah.
Okay. My name is Castro Kisuule. I am an obstetrician and gynecologist. I work with Alexandra Medical Center and with Nsambia Hospital. I am young and passionate about women's health.
Amazing, amazing. Yeah. First of all, for our guests, you're very welcome. One interesting thing about Castro is that we've actually been together since high school, and even back at medical school, we're in the same discussion group. So it's amazing that we find ourselves back here discussing together.
Yeah, and a
Amazing.
roommate at one point.
Exactly. Yeah. And in fact, on campus, we're actually roommates. It's interesting. Anyway, I'm sure our guests want to hear more medical kind of sounding things. So today we shall be discussing polycystic ovarian syndrome. Most of the people I think know it as Pcos. And Castro, I think you shall get us going. Tell us, Castro, what is Pcos?
All right. So I prefer to call it more of a PCOS, just to make it more internationally recognizable, because PCOS is not as recognizable as PCOS. So polycystic ovarian syndrome, or PCOS, is the commonest hormonal imbalance in women. Usually, you hear people talking about an imbalance in hormones, or people saying I have a hormonal imbalance. So PCOS generally is about an imbalance in sex hormones in the female. They have an imbalance more to the male hormones more than the female hormones. So this condition leads to a various number of conditions or symptoms, but all based on the polycystic ovary.
All right. By the way, for our guests, if you've just tuned in, it's your first time, you're very welcome. Be sure to like and subscribe. There's contact information at the bottom. If you have any questions, leave them in the comment section, and we shall answer them at the end. All right, Castro, you have talked about PCOS, as you've had. What's the cause? Could you break it down a little bit more in terms of like those hormones, their interactions? Are there any other hormones involved? I mean, things like insulin and what? Could you bring that in and shed some light on that?
Okay, so polycystic ovarian syndrome has no known particular cause. However, we have certain risk factors of people who are more prone or who are more likely to get to polycystic ovarian syndrome. So we know that there is some genetics, and this has been studies done in twins, for example, identical twins. If one twin has polycystic ovarian syndrome, it's very likely that the other twin will get. So there's a lot of genetic predisposition. If a mother has had, a daughter might have. If a sister has, another person in the family might have. We also find that people who are obese are prone to getting polycystic ovarian syndrome, especially obesity that comes pre-pubertal. Pre-pubertal would mean around 8 years, 7 years, 6 years. So childhood obesity is a risk factor to getting polycystic ovarian syndrome. Yeah. So those are the ones I can think about now. But there are many other things that can predispose a woman to getting polycystic ovarian. There are certain studies looking at exposure of mothers who are pregnant to androgens, later on giving their babies polycystic ovarian syndrome in life. If you are born a bit too small or a bit too big, so if your birth weight was lower than 2.5, or if your birth weight was more than 4.5 kilograms, you're more likely to get polycystic ovarian syndrome as an adult.
Yeah. Yeah, and that's interesting. First of all, you mentioned the term androgens. Maybe if I add something, could
Yes.
you
Okay.
um,
Yes. So
break it
androgens are
down?
mainly male hormones. Male hormones. So we know that men and women produce male hormones,
Yeah,
but the males usually produce much higher male hormone than the female. The female
yeah,
also produces male hormone, but in small quantities. So for
yeah,
women with polycystic ovarian syndrome, their male hormone produced, instead of being it very small, it's a very large amount, and therefore
yes.
causing an imbalance in hormones.
Yes, and I think it's interesting that you mentioned obesity in the pubertal years, and we have a lot
Yes.
of childhood obesity, and a lot of these adolescents even coming in with obesity these days. I like sharing with my clients, like in the case like so of diabetes, which is associated with
Mhm.
Pcos, with PCOS, as we shall
Mm.
find out because of the insulin resistance which happens, and we shall explain insulin
Mm.
resistance going on. We find that we are having a lot of the younger ages coming in with type 2 diabetes. I think in Uganda right now, we are looking at the average age of people with type 2 diabetes being 35 years, which for if someone knows their maths, if it's 35 years, it means it's more of these, of the smaller values of years. So 20s and what, which is contributing, bringing that average down.
Mm.
Back in the day, and even now, there are a couple of people who still think that diabetes, high blood pressure are diseases of the white man. But the thing is that actually we find that the people in the Western countries are getting diabetes, high blood pressure at 50 years, 60 years. And for them, it was mostly because of their lifestyle. They weren't very active. Many of these fast food kind of stores and shops were there, and people are eating lots of these foods. But we're having now all these coming here to Africa, and actually, genetically, Africans and Asians are more predisposed to these conditions. So it's something for
Yes.
us, for the guests to watch out for. All right, so let's go on. Castro, what are the signs and symptoms? How can somebody know that they have it? Maybe
Okay.
we could first start. We could first start with the symptoms, something which somebody may notice before we go to more of the clinical things like maybe hormone tests and what. Yeah.
Okay. That's a very good question, Dr. Etuket.
Yeah.
So what will I have for me to
Yeah.
think, this could be polycystic ovarian syndrome? The most common abnormality is your menstrual cycle. So the menstrual
Mm-hmm.
cycle will begin to become abnormal. In which ways? Typically, a woman with polycystic ovarian syndrome or PCOS
Mm-hmm. Yeah.
will miss a few months of her period.
Mm-hmm.
So, for example,
Mm-hmm.
she's supposed to have a period now in October. She misses a period. She's not
Mm-hmm.
had sex. Therefore, she can't be
Mm-hmm.
pregnant. And
Yes.
then she will miss again in the next month, November, and then miss
Mm-hmm.
again in December, and then she will have
Yeah.
heavy bleeding in February. So,
Mm.
if you have menstrual irregularities, or in a year you have maybe 3 or 4 menstrual cycles, or periods, then you're likely to have polycystic ovarian syndrome. However, there are other things that also come with it. So menstrual irregularities, either you're missing
Yeah.
periods or you're having very
Yep.
few periods in a year. Then
Yep.
some will develop acne. So
Mm-hmm.
acne, those pimples on the face,
Pimples. Yeah.
Yep. Then others will have some excessive amount of hair. So they will have hair that is in a male type distribution. So they'll have a
Yeah.
beard, they may have
Beards and
a mustache, and they'll
gosh.
come to tell you, doctor, I often shave, I shave so often, things that are
Yeah.
not usually normal for
Mm-hmm.
a woman. So that's
Yeah.
what will happen. Then
Yeah.
later on, people will also come and say, doctor, I'm failing to conceive. And
Mm-hmm.
therefore, if people have infertility, it can also be a way to diagnose polycystic ovarian syndrome, because people with PCOS may struggle to fall pregnant. So those are the
Yeah.
commonest ways those are the commonest symptoms seen with people with polycystic ovarian syndrome.
All right. All right. Thanks for that, Castro. So are there any other risks associated with PCOS? So if somebody has PCOS, are there any other things which somebody could then get, whether it's like for the lady in pregnancy or even or even after pregnancy?
Yes, for sure. There are actually quite a number of risks or conditions associated with polycystic ovarian syndrome. Now that we've talked about it being a hormonal disease, and this hormonal disease causes an imbalance, there are a cascade of events that go on behind this hormonal imbalance. The biggest risk factors we see with people with PCOS is what we call metabolic syndrome. Metabolic syndrome, you'll get someone who's obese, hypertension, type 2 diabetes. Okay.
Yes, and then also
obesity, type 2 diabetes, hypertension, and dyslipidemia. So they get high cholesterol. So they get high cholesterol. So those usually come together. Then they're also at risk of certain cancers like endometrial cancer. They're at risk of anovulation, therefore they will have no children. I mean, they will have infertility because they'll have issues trying to get pregnant. The other issues with polycystic ovarian syndrome, because of obesity, hypertension, infertility, they tend to get anxiety and depression. So that's something that we need to look out for, because people who have PCOS are usually overweight or obese, and it affects their self-image. And when it affects their self-image, they're at risk of getting depression and anxiety disorders. The other thing that may be associated with weight is, when people get fat, they also get fat in the neck. And when they get fat in the neck, when they sleep, they snore a lot and get what we call obstructive sleep apnea. So they are usually chronic snorers. Is that the correct word? And
we can
and
take
then
it.
And then when the weight gets onto the windpipe, then it affects their oxygenation. So then they get troubles with breathing at night.
Okay. First of all, would like some interaction from our guests. Do you know somebody who has PCOS? No need to mention the person's name. You could just type a yes in the chat bar. And another thing you could do is, if you're finding this information valuable, like the video, share it with a friend. If you know somebody who has PCOS or who knows somebody who has PCOS, share it with a friend so that we can share the love around. All right, Castro, there's just yes, I just wanted to just add something. Again, since TIMNATH is more on the metabolic side of things, and so on there's we also know that there's at risk of the gestational diabetes. In case they're to get pregnant in the future. Yes, and one thing which I want to inform our viewers is that even in terms of the cholesterol readings, typically you would go to a clinic and say do a lipid profile test, and there would be ranges for the different parameters: total cholesterol, HDL, LDL, triglycerides. But it's important to go beyond that. Like that would not be necessarily enough. Some of the ratios, say triglycerides to HDL, some of those are actually very important in actually getting a better picture to see if there is actually risk of cardiovascular events, things like stroke, things like heart attack. And we are taught that a diabetic has, could say, 5 to 10%. 5 to 10 times higher risk of getting a heart attack, getting a stroke. So this one thing about PCOS, Dr. Kisuule has mentioned the hormones interacting. So you have your female hormones and your male hormones mostly becoming higher than they should be, and then some abnormal response of the body to those hormones. But there's also that thing of insulin, which I've mentioned, which comes in the metabolic syndrome. And the insulin resistance. Insulin resistance, basically what happens is, insulin is this hormone, just for the sake of our guests, insulin is this hormone which helps our cells, particularly our muscles, take up glucose from the blood. Our muscles take up about 60 to 70% of the glucose, which we take in food. So for our viewers, if you take, say, a sweet potato, you eat it, it gets digested to your stomach, in the small intestines, and then glucose is absorbed. If you eat your fruit, glucose, fructose is absorbed into the blood. Now that's going to stimulate your pancreas to produce insulin. So glucose particularly causes that insulin response. If you have fat on its own, it actually doesn't cause a marked insulin response. However, fat and glucose, so if you're eating cake with frosting, if you're eating matoke and eshabwe for our Ugandan lovers there, if you're eating, if you're having beer and then with pork, you understand, you're having fat and then your glucose from the beer, you find that the insulin response is even much more. Now, it should be a good thing that you're producing insulin, but actually, like, your muscle cells at some point become that, like, they're being stimulated too much, so they become resistant. So your muscle cells are not taking up glucose well enough. So what happens is that instead of the brain telling your body to reduce the insulin being produced, your body reads it as, we are not getting enough insulin. Our muscles are not taking in enough of the glucose. So you feel weak. You understand? You feel weak, yet you're eating a lot. So I don't know if anyone you could share in the chat, someone in the chat, you could share if you identify what I'm saying now. If you remember a time when you were really hungry and then you say, take a soda, you're really hungry, you drink a soda. And within seconds, within, say, 10 minutes, you realize that you're satisfied, you're energetic, you're up and going. But if you give it another 15, 20 minutes, you realize that you actually crash. Like, you become tired, you become foggy, like the brain becomes foggy and that kind of thing. It's because you've taken in refined sugar. So the sugar gains direct access to the blood. A lot of insulin is produced, which pushes that glucose into the muscles, as we've talked about, the normal process. Now, what happens is that your insulin levels drop far below than they should be. So this repeated spiking of insulin also has been associated with insulin resistance. So that's why we tell people normally, eat foods high in fiber. You understand? Eat foods high in fiber, eat protein-rich foods, because these foods actually don't cause those massive insulin spikes. So if you keep doing that over time, you become resistant, and then you find that you have high levels of insulin in the body. Now, the research shows that the interaction of that high insulin levels and the insulin resistance are going to interact negatively with the reproductive hormones, actually beginning with the hormones which are produced from the brain to stimulate your ovaries and your adrenals to produce those male hormones and the female hormones. Then that whole interaction of the hormones in a negative way is going to result into this PCOS. So if somebody has ever encountered something like that, yeah, you could just share that in the chat. And yeah, that's why we tell you, eat foods which are high in fiber, as we shall find out in the management, I guess. Remember, by the way, guys, leave your comments, leave your questions in the comment section, because we are going to answer them at the end. All right, Castro, let's move on. Polycystic ovarian syndrome, how is it diagnosed? Yeah, tell us.
Okay, yeah, so PCOS is usually diagnosed by a medical practitioner, most likely a gynecologist, but any other doctor can recognize the
Yes.
PCOS and diagnose it. So we usually use a criteria which involves, one is someone has menstrual irregularities, so either they're missing their periods or they're having few periods in a year. Number two is they have some kind of male distribution of hair, which is like some kind of hirsutism. We call it hirsutism in some medical language, but it just really means you have beards, you have a mustache, you have hair on the belly, all right? You have some excessive hair on the legs, and you have to wax it, or you have to shave every week or every day. And then the other one is we usually look for ultrasound features, where on the ultrasound, we see your ovary with many cysts on the peripheral. So we usually refer to it as beads on a string. So if you know beads on a string, if you have beads on a string, they have a particular distribution. That's how polycystic ovaries look like. And then the other way we can diagnose it is to do your blood tests. And blood tests will usually show us an imbalance in your hormones, where we have more male hormones than normal. The other thing we also do is to also check your androgen, your insulin in the blood. So usually people with PCOS have a high insulin. They have a lot of insulin, as you've explained, Dr. Etuket, that it's important that we put all this together. So any two of the criteria I've mentioned usually puts you in the category of PCOS.
Yeah. Yes, and if I may just add on the side of insulin resistance, we can do the insulin levels, yes, but if in a place where the insulin levels cannot be done, you could do the fasting blood sugar. You could do another test called the glycated hemoglobin. We call it in short HbA1c test, and basically this shows the amount you see, and that's another reason why you should not take lots of glucose. The more glucose you take into the blood, glucose gets into the blood and binds to proteins in the blood. And one of the easiest proteins for us to measure is the hemoglobin. So we are able to measure how much of the glucose is binding to the hemoglobin, and we do that test, HbA1c, and it should not be high. So I tell people normally at least correlate the fasting blood sugar with an HbA1c test. If you can do both, better. But I think fasting blood sugar is the most available. Then I think HbA1c, then I think insulin. Yeah, but yeah, those are some of the tests which you could do for that. One other thing which I'd like to point out to our guests is that the research actually shows that they have actually identified, remember Dr. Kisuule talked about there being a genetic factor in this PCOS. So like if there's a twin, say for example, who has PCOS, it's very likely that the other twin will get it. But so they have actually found that some people who are lean, you understand, and have normal insulin levels, but then they have PCOS. So it's just something to know. It's not only obese people who can get it. There's a small percentage, but even people who are lean, people who have normal insulin levels can also get PCOS because of the genetic factor, which Dr. Kisuule talked about. And again, I don't want our guests to panic. Remember, Dr. Kisuule has said 2 of the criteria. So don't, again, get too anxious if you see hair maybe in a certain place, that kind of thing. Better come in and check, that kind of thing. And I think Dr. Castro, director at Alexandra Medical Center in Kampala, for those who are in Kampala, you can just check out their website. Those details are in the description section. Check them out. Dr. Kisuule, amazing gynecologist. He'll help you out. All right, so let's move on. Remember, guys, like and subscribe. It helps us. It helps the channel grow and helps this video be shown to more and more people. So hit that like button. Just take a second. Hit the like button. Subscribe to the channel. All right. Diagnosis. Let's go on. What are the treatment options for PCOS?
Okay, so treatment options are actually varied depending on what the woman really wants or what her issue is. As you mentioned, as we discussed earlier, women with PCOS may present with different issues. Some may present with menstrual irregularities, and if someone has menstrual irregularities, the treatment choice of option is the treatment option of choice is usually a birth control pill. We give them a birth control pill to regulate the periods. It will help them also have contraception as well as regulate the period. And then we shall talk about later what kind of pill we can give. And the other issues the other way we can also treat menstrual irregularities is to use newer formations of tablets. Now we have a myo-inositol. It's a chemical that is released less in people with PCOS. So if we supplement them with myo-inositol, they can get menstrual regularity. So there are those who present with hirsutism. So they say, doctor, my periods are not well. I have hair distribution. How can I work on it? We can also give a birth control pill that has a drug in it that reduces the male hormone. We also have other drugs that we give that will be of help in reducing the amount of male hormone, like spironolactone, which is an antihypertensive. We use that a lot. We also have other drugs we can give for abnormal hair distribution. Because of the metabolic issues that come, the diabetes, the hypertension, the hyperinsulinemia, we also advise women to take metformin. We give them drugs like metformin to help them regulate their metabolism and also reduce on the hyperinsulinemia. For those who are struggling to get pregnant, we usually give them drugs to stimulate the ovaries to ovulate, because one of the biggest issues with PCOS and infertility is that women with PCOS do not ovulate regularly. If I'm to give a number, they ovulate maybe once or twice in a year, whereas a normal woman is supposed to ovulate every month. So this is 12 times a year. So with people who are struggling to get pregnant, we give them drugs to help them stimulate their ovaries to help them ovulate. And when they ovulate, the chances of getting pregnant are higher. Then for those who have failed to, we've given treatment, they have failed to respond. We also have some surgical methods in which we can treat PCOS. We give them, we have a procedure we call laparoscopy, which is a keyhole operation. We do a keyhole operation and make very small holes in the ovaries so as to ablate or to kill the areas that are making male hormone. And with time, the male hormone production goes down, and then they're able to fall pregnant. So we call that ovarian drilling. Yes. So those are the treatment options we have for PCOS currently. So the hormones that we give, the birth control pill, we give a hormone that has an anti-androgenic property. So we give a birth control pill, but has a drug in it that also reduces the amount of male hormone produced. And that is best suited for women with PCOS. So remember the first line treatment. If someone comes to us with PCOS, the first line treatment we give is actually diet and exercise. So diet modification plus exercise, because we know that loss of weight of just 5% will increase the ovulation rate or the ability to get pregnant by 50%. So that is why we offer weight loss first by dietary modification and exercise, because when you lose weight, your ability to get pregnant goes up, your PCOS symptoms are controlled as well.
Okay, Castro, I think at the end, we just, on that last point, you talked about the first line treatment. It was being a bit shaky. Maybe you could just repeat that quickly. Yes. What's the first line treatment?
So the first line treatment for PCOS is dietary modification and exercise. The reason for this is that loss of weight, just 5% of your weight loss. If you lose just 5%, if you're 100 kilos and you just lose 5 kilos to 95, you increase your chances of ovulation or getting your menstrual cycles regulated by 50%. So we encourage women to engage in weight loss programs like those at TIMNATH, and also to have some kind of an exercise routine that keeps up with their good health habits, which will prevent them from getting diabetes and hypertension.
Great. Sis, thank you very much, Castro. Before I shed a little bit more light on the weight management, I just want you to tell our guests something about the ultrasound. Is it a normal ultrasound which we do? Is it a particular ultrasound which we do when we are diagnosing PCOS?
So the particular ultrasound we prefer to diagnose PCOS is usually what we call an internal scan, or what we usually refer to as a transvaginal scan. The transvaginal scan probe actually sees the ovary much better than a probe on your tummy. So we prefer a transvaginal scan. If you haven't done one for diagnosing PCOS, it's preferred that you go to a place that can offer a transvaginal scan.
Okay. About the transvaginal scan. So this transvaginal scan, like the probe is passed through the vagina,
birth
and
canal.
then yes, the birth canal, yes, and then it is viewed. So this question is: would you recommend it for somebody who's a virgin, a girl who's a virgin? Can it be done?
No. So we wouldn't recommend. If a person has not been exposed to sex, we will not do a transvaginal scan. We can do an abdominal scan, and then we tie up the findings of the abdominal scan with the other symptoms, and then make a treatment plan. But absolutely not for a person who's a virgin.
Yeah. So perfect. Yeah. So that's a point which I wanted to come out for our guests, because I actually had a friend who, a couple of years back, she was a virgin then, and she went to a certain place and they did a transvaginal scan on her, and she said that she bled, and I was like, But why did they do that? You understand? It wasn't fancy anyway. Now, what about a 3D ultrasound? Would it be able to have some superior value in diagnosing PCOS over the conventional?
No, it wouldn't. The conventional 2D ultrasound is enough. A 3D will not improve. It will not improve your diagnostic accuracy because these are very easily seen on a 2D scan.
Okay, perfect. So again, our guests, as you're saying, Dr. Castro is helping us. Don't be swindled in a place. Yeah, don't go and pay a lot of money for 3D scan. If you have PCOS, it should be a transvaginal scan. If you are virgin, then there are other ways of the doctor patching together the information to make a diagnosis. Yes. So again, on management, maybe let me just shed a little bit of light on the weight management part. Let me just shed a little bit of light on the weight management part.
Yes, please.
As Dr. Kisuule has mentioned, PCOS is a multifactorial. It's multifactorial disease, if I would say. Different hormones coming into play. So you notice Dr. Kisuule has talked a lot about the reproductive hormones. The interventions are really, which he has mentioned, are targeted towards the reproductive hormones. So while you're doing that, and he has mentioned that first line is really weight management because it's the cheapest. And actually studies show that, even just reducing your weight by 5%, just 5%, it will actually increase your chances of ovulating and your periods resuming. Actually, I had a client a couple of years back, about 2 or 3 years back, just losing 5 kilograms in a space of about 4 weeks. Periods returned. You understand? Yeah. So just losing weight, and then if you're able to lose 5 to 10% of your weight, so say you're 90 kilograms, if you're able to lose 9 kilograms, you're actually able to improve your insulin sensitivity markedly. You understand? And for us, basically, from our interaction with our clients, if for somebody who adheres to the right kind of program, exercise which is targeted towards boosting insulin sensitivity, and then also a diet which is targeted towards boosting insulin sensitivity, and then other things like sleep, which I've mentioned. We have found that people are able to lose between half a kilo to about 1.5 kilos per week. So in a 6-week program, you're able to lose 9 kilos. Actually, one of our most recent clients lost 9 kilograms in 6 weeks. She adhered to the diet and everything. She wasn't actually even doing so much of exercise. And that's something which I really I keep trying to inform and reiterate to our clients. People have this notion that I need to lose weight, and they go and begin jogging for 2 hours, doing dance class for 2 hours. And yes, all these may make you feel good that you've sweated. And that's another thing. People think that if I've not sweated, I have not done work. And sweat is very relative. Like, I'm a person who sweats easily, but there are people who can come and do everything, lift weight, run, and they won't break a sweat. You understand? So it's not sweat. It's about the technique which you're using. Yeah. So if you lose your weight, just imagine just losing 5% of your weight, say for a 90 kilogram person would be about 5 kilos. And you can do that in 6 weeks, tops. If you're really slow, in 2 months. That's like if you're really super slow, which you shouldn't. Yeah. So weight management, I'll talk about that very, very briefly. That basically what you need to do is reduce on the stimulus for the insulin production. Because remember, we have said that in PCOS, what's happening is that you're having high insulin levels, and then also insulin resistance, and then this is negatively interacting with the male hormones, testosterone, androstenedione, and others. You understand? So what you want to do is reduce on that stimulus. So we need to start adopting low carb diets. I like telling my clients, of your 3 macronutrients, protein, carbohydrate, and fat, if you don't have carbohydrate, if you don't have glucose, so glucose is the breakdown product of carbohydrate. Okay, it's the most important one in this discussion. If you don't have glucose in your blood, like if you're not eating carbohydrate, your body can manufacture glucose for you. It will manufacture it from your protein. It can manufacture it from the fat. But if you don't have protein in your diet, your body can't make protein for you. Like it can't build muscle for you from nothing. And muscle needs to be built by protein. And we all need to improve our muscle percentage, both men and women. So I tell people, we need to remove from our notion this thing of carbohydrate that I'm feeling weak. I think it's because I haven't put in some carbohydrate. Actually, many a times the reason why you always feel foggy in your mind and what is because you're over dependent on carbohydrate. You understand? Things like ketones, which are produced from fat. From the healthy fat, of course, I'm not telling us to now go and eat lots of processed foods and that kind of thing. No, no, no. Talking about nice healthy fat, things like avocado, sunflower oil, olive oil, nuts. You understand? That fat. When we actually adopt low carb diets, and remember we mentioned that glucose binds to hemoglobin, binds to proteins in the blood, and that's actually what causes all these issues with cholesterol and putting at risk of cardiovascular accidents, cancers in the future. So we need to reduce the amount of glucose. So how do we do that? If you can cut refined foods out of your diet, well and good. If you can limit it to a cheat meal, not cheat day, like a cheat meal. Because when you do a cheat day, yeah, if you can limit them markedly, that really help you. But if you need to eat carbs, then eat carbs which are high in fiber. Eat lots of vegetables. Opt for sweet potatoes instead of things like rice, instead of things like posho, if you can. Opt for yams, that kind of thing. Opt for foods which are really high in fiber. That's a whole topic for another day. So I'll just mention snippets. And then another thing which you can do to improve your insulin sensitivity, there is a diet called the keto diet. It's not actually a fat diet. It's medically proven. There's research to it. Eating a diet which is high in fat, but very low in carbohydrate. You understand? Remember what I said, your body doesn't need that glucose. And remember I said that fat doesn't stimulate an insulin response. So when you adopt a keto diet, now I'm not saying that go and buy fries with fries and then you're eating it with, I don't know, with like lots of fat and that kind of thing. No, no, no. That's high carb and high fat, and that's a very bad combination. High fat, what I'm saying, high fat and low carb is something like eating, say, chicken. Maybe it's fried with healthy oil, not with your buto, for those under buto and that kind of thing. No, healthy oil, sunflower, olive oil. And then you have a nice serving of vegetables, some avocado. That kind of diet is one which I normally recommend for people who actually come in with these insulin-resistant syndromes. You understand? So you come in with metabolic syndrome, you're obese, your cholesterol is off, you have PCOS. Those are the kind of diets which I actually recommend because the studies have shown, but even from our clients, we've been able to see very effective fat reduction, correction of cholesterol levels, correction of the blood sugar levels, high blood pressure is done away with, and that kind of thing, if it's prescribed in the right way. But if you can't do a keto diet, just reduce the amount of carbs which you're taking in. Again, and then on the part of exercise, I encourage people to do some, once in a while at least, do some high intensity kind of exercise, because that low intensity exercise doesn't really help with muscle. And one of the things which helps to boost insulin sensitivity, which is the opposite of insulin resistance, is improving muscle percentage. So that's why I say, and almost everyone who comes into the clinic who's obese, not actually almost everyone, I can confidently say everyone who comes into the clinic who is obese, at least to our metabolic clinic here at TIMNATH in Bugolobi, or who is obese, when you measure their fat and their muscle percentages, their muscle percentage is low and their fat percentage is high. Like it just correlates automatically. You understand? So we need to improve our muscle percentage because remember, muscle takes up glucose. If you have a healthier muscle percentage, you'll be more able. I mean, we normally ask, there is that small person who eats anything he wants and he never puts on weight. That's one of the reasons, because the muscle is there to just scavenge and take up that glucose. However, that person must know that because they're eating unhealthy food, refined sugar, high fat, high carbohydrate at the same time, they are actually slowly becoming insulin resistant. And one day, unfortunately, if they continue doing that, they will actually become type 2 diabetic. And then finally, things like sleep. Like sleep is something which is, it's so important and so easy to implement, but we take it for granted sometimes. 7 to 8 hours is what is recommended on average every day. I know life happens and things happen and that kind of thing, but as much as you can, if you know it in your head that I need to sleep for 7 to 8 hours as much as possible, when you want to go and watch a movie, you may make another decision. There's a research which showed that actually when we sleep, if you've been eating well, if you've been working out in the right way, you actually lose fat and build muscle. You understand? So basically what these people did, they got a group of people, took them through the same diet and same exercise for 2 weeks. But half of the group slept for about 5.5 hours on average, and the other group slept for 8.5 hours. Fine, 8.5 hours was really overboard, but 5.5 hours, 8.5 hours. The group which slept for 5.5 hours lost 0.6 kilograms of fat over the 2-week period. The group which slept for 8.5 hours lost a whopping 1.4 kilograms over the 2 weeks. You understand? So that's almost 3 times the amount which the other group lost. Yes, so sleep is very important. Sleep, diet, exercise, that's and then managing stress. Like, we need to manage stress. Stress. I mean, it's a whole topic, but those are just snippets. I guess we could maybe address that. If you want to hear more about those individual things, anything to do with PCOS, please leave it in the comment section. We will review them, and if we need to have Dr. Kisuule back here, I'm very sure he shall be willing to be back here. All right, Castro,
Yeah,
thanks.
sure.
I think what I'd want us to do, as we're about to wind down, remember, if you found value in this video, if you caught it halfway, don't worry. To be on our YouTube, you can just watch it afresh. Watch it when it's done. Like, just go back and watch the whole thing and share it. I want to remind us, share it with somebody who you think would benefit from this. So I want us to just tackle a few questions, Castro, if you don't mind, as we wind down.
Yes, sure.
Okay. All right. So I'll just look at these questions. Okay, this is Grace. She says, Grace actually was our classmate. Thank you. Hi, Grace. Yeah. Thanks, Castro and Andrew. When a woman with PCOS starts an exercise regime, loses weight, and conceives thereafter, does she continue with the exercise, especially in early pregnancy? Okay.
Yeah. So
Castro,
it depends on
Okay,
it depends on the exercise she's done, on what routine she has developed. But there's nothing that stops her from continuing it in pregnancy, especially if she doesn't have other risk factors in pregnancy. So, for example, if she's not bleeding in early pregnancy, if she has no symptoms of a miscarriage, she can continue what she's been doing. Yeah.
Okay. Yeah. I think if I was add on that. Okay, go. Finish. Can finish it.
Yeah, so I forgot to mention that if a person with PCOS gets pregnant, we often ask them to continue their metformin or to continue metformin. If they haven't been on it, they get on it during pregnancy for the whole pregnancy until labor. Yeah. And then we watch out for things like gestational diabetes in pregnancy, which means we have to screen for gestational diabetes. Yeah. We also have to screen for hypertension in pregnancy. And once we have those under check, then we should be good to go for the pregnancy.
Yeah. So I think what basically Dr. Kisuule is saying is that once you've been diagnosed with this thing, you're really going to need to keep on tracking at least ever so often, to make sure. And another thing is that we need to remember that diabetes, high blood pressure, okay, so insulin resistance, which can manifest ultimately as diabetes, high blood pressure, abnormal cholesterol levels, they are heavily interlinked. So it's better you screen for all of them. Don't just go and check your sugar and leave your pressure. You understand? You need to screen for all of them. I want to shed a little bit more light on the exercise bit. Again, so this woman lost weight, was able to conceive, and then just look at it again. Yeah, conceives, and then, so when she's pregnant, does she continue with exercise? I would assume that a primary goal of this woman would be to lose weight. So in the context of losing weight, I want to talk about what does the research say. So basically, if we're doing cardio is the best exercise for losing weight, like for losing fat. I won't say losing weight, for losing fat, but it has to be done the right way. When we do cardio, we lose a lot of fat. When we do high intensity exercise, lifting weight and that kind of thing, we tend to predominantly use glucose during the workout. However, when you do cardio, we use fat. However, when you lift weight, it helps you improve your muscle percentage, boost your metabolism, and then over the course of months, you actually end up losing more fat and burning more calories. You understand? Because you've increased on your engine. Now, let's first deal with cardio. You can do low intensity cardio, you can do moderate intensity cardio, you can do high intensity. Low intensity, it's just walking. You're just walking, and anyone can walk, really. Walking at a slow pace. So nothing excessive, you're not jogging and that kind of thing. Jogging is more in moderate, you understand? So maybe if you're going to swim, you're swimming at a really slow pace. closer towards low intensity. And then moderate intensity jogging, maybe running on a treadmill, maybe playing some badminton, playing football, that would be maybe moderate intensity. Then high intensity is really like high intensity interval training. You're doing some high jumps, you're doing some skipping. Skipping can tend to be maybe moderate towards high. You're maybe sprinting, you understand, that kind of thing. It's high intensity. Now the research shows that you lose over months, you lose most fat when you do low intensity exercise, low intensity cardio, and high intensity cardio. You may seem to burn more. When we're doing jogging, it may look like we're burning lots of fat, but the challenge which comes is that moderate intensity cardio has been associated with loss of muscle, especially jogging. You understand? So if you're going to do moderate intensity cardio, swimming and that kind of thing, because it involves also the hands and what, it tends to bring in more of the muscles and what. If you're going to go on that elliptical trainer, the one which also has the hand, what they call them, levers, if I'd use that word, I don't know if I'm using the right English, that kind of thing. Yeah, that's a little bit better. But jogging on its own has been shown to result on long term in loss of muscle mass. And I keep telling people, any weight loss program which makes you lose muscle, if you ever lose weight and somebody says that, Castro, you're looking sick, just know that weight loss program was doing you a disservice because you lost muscle. When you look sick, you find someone loses weight and the cheekbones are compressed in and that kind of thing. That is basically because you're losing muscle. You understand? Or they become thin, not lean. Lean should mean that you have some definition. You understand? Some kind of definition. And I tell people, don't fear muscle. It's the easiest thing to lose. If you see too much muscle, just stop lifting weight or stop doing high intensity exercise. It will go within a week. You understand?
Andrew,
yeah.
doesn't anyone who lose weight drastically look sick for everyone?
No, and
everyone.
I can actually share. I can actually share with us pictures. No, you don't. We have people who lose weight, and people say you're looking young. You understand? There's a difference. I don't know if you've ever seen somebody, and I've seen that the next question is talking about juicing. So let me just address it even now. If somebody goes for a juicing program, so first of all, I need to help demystify this myth. People say fruits are healthy. Is that right, Castro? We could say fruits are healthy. Yeah, it's half a lie and it's half the truth. Fruits are healthy. That notion mainly came up because we're talking about vitamin C. We're talking about vitamin E. We're talking about vitamin E, which is antioxidants. Which is detoxing your body basically. It's rich in vitamin E, which is an antioxidant. But we need to remember that fruit is rich in glucose. It's rich in fructose. Fructose especially has been implicated in insulin resistance. And typically most of the fruits, especially around, at least our set in Uganda, they tend to have more, when you talk about the amount of sugar, the amount of sugar relative to the amount of fiber they actually have, fruits actually have lots of sugar. We talk about bananas, we talk about mangoes. In the Mediterranean side of things, where there are the like the apples, the berries especially, you're now getting a better bang for your buck. But in our setting, typically the fruits we have, they tend to be very high in glucose and in fructose. But again, a thing which has been sold, this is actually happening in the Western world. It's a notion which was sold more by the food and agricultural industry. Things like, no, it's natural sugar. There's no such thing as natural sugar. The body understands glucose as glucose. At the end of the day, glucose is getting into the body. So, and then fructause.
So which fruits are bad? Which fruits are good? Which fruits are bad?
So basically, now let's first talk. I don't want to be like, we did not do history, Castro, but we know about Maria and Antoinette, is it?
Antoinette,
yes, exactly. Who, like the people were saying that we want that we want to have.
There's no bread.
We don't have bread. We don't have bread, and then she was like, "If you don't have bread, eat cakes." So but I want, forgive me, our guests, but let's just discuss it like first openly. Let's first say the ideal case. If we can reach out for anything, we can. If I was to start from here, where this is being good and this is not being so good, I would start with my berries. So if you can get blueberries, strawberries, guavas, I think are fairly available. I'll put guavas also around that zone. I'll put pawpaw. I'll put apples and pears somewhere there. As I'm moving this side, because if I miss out a fruit, you can tell me, and then I can find where to put it. Then I'll put oranges, tangerines somewhere there. I'll put my banana somewhere there. But at this extreme, pineapple, I'll put it somewhere here. I'll put pineapple mangoes somewhere here. You understand?
Okay.
And then if I'm to come to the end, I'll really have things like watermelon, jackfruit. Like, it's very low in fiber. You understand? It's very low, and fiber is the thing. Fiber is food for our microbiome in our stomachs. Aids digestion, aids digestion. Lots of importances from those. Lots of benefits we get from fiber. So these fruits this side tend to have lots of fiber. So if you can find the fruit you want and it's somewhere this side, if you can choose from something closer this side, it's better. But still, we need to regulate the amount of glucose which we take in. So that's why I said the whole thing of, first of all, so that's the first issue with now loading yourself with lots of fruit. You understand? If you want fiber, go and eat vegetables. Vegetables have vitamin C. They do have them. The dark green vegetables actually have lots of those vitamins which you're looking for. It's actually just something which we just have in our head. You understand? The vegetables give you, if you eat a wide variety of vegetables, different colors, dark green, if you can have like your carrots inside there, and that kind of thing, you're going to get, and remember, vitamins are a micronutrient, not a macronutrient. Macronutrients, protein, carbohydrate, fat. Micronutrients, vitamins, minerals. So you don't need too much of the vitamins. If you eat a whole platter of fruit, your body is not going to get, it's not going to use all the vitamin C which you get from there. Most of it is going to just get out in excretion because it's too much. You do not need all of it. So that's the first issue. Eating, actually, somebody who comes with type 2 diabetes, and I put them on a meal plan, we are definitely going to watch the amount of sugar you're eating, the fruit inclusive. You understand? We're going to tell them to eat lots of vegetables instead. Now, the other thing about juicing is that fruits are very low in protein. Protein is needed for your immune system, for keeping your muscle tone. There's something called the thermic value of food. So basically, when we eat protein, for us to digest it and assimilate it, we actually burn a lot of calories doing that. So you're eating calories to burn calories. Isn't that amazing? Wouldn't you want to eat that kind of food? But carbohydrate and fat actually have a low thermic value. We don't actually burn too many calories by digesting carbohydrate and fat. So that's why protein is the most important thing on your plate. And yet it's absent in fruit. So when somebody goes on a juicing diet, if they have not been doing anything, if they've been eating lots of junk food, doing bad manners, if I'd call it that, when they go on a juicing diet, or if they start jogging a lot, because when you jog, you lose a lot of calories, but which is actually harmful in the long term, you lose a lot of calories. So if you do that kind of thing, juicing, and you've been doing bad manners before, you will lose a lot of weight for the first maybe week. You'll actually be above. Remember I said healthy weight loss is 0.5 kilo to 1.5 kilos per week. You'll actually most likely be in 2 kilos per week. You understand? I've had people who are in 2.5 kilos per week. You understand? And normally I tell them, hold on, you're most likely doing something wrong. And we always find it's either that they're missing meals or they're doing a lot of cardio. So you lose a lot of calories and you lose the weight. But at some point you will plateau. And anyone who is obese and has tried losing weight and has done something like juicing, they will tell you that at a certain point, most likely they plateau. You understand? And if you keep insisting, there's a high chance that you're actually going to regress. Why? Your weight loss is not just about calories in, calories out. Hormones come into play. You understand? Insulin comes into play. Understand? And basically what happens is that when we expose ourselves to long episodes of calorie deficits, long episodes of excessive calorie deficits, juicing, excessive cardio. I had a friend who was doing 1 to 2 hours of jogging 5 to 6 days a week. That guy lost muscle mass. He lost muscle mass, and after a certain point, he actually began putting on weight. You understand? He came in and tested, and his sugar was off. And you ask yourself, but I've been doing all this. So what happens is that when you expose yourself to long durations of excessive calorie deficits, your body begins priming yourself to conserve energy. So that's why, if you remember, for the guests, Dr. Kisuule said risk factors for PCOS and for insulin resistance and metabolic syndrome in the future, in the future, are infants who have a very low birth weight, but also those who have a high birth weight. Those who have a high birth weight, it's quite understandable easily, right? But those who have a low birth weight, it's because they have been primed to scavenge. So actually, in the pathophysiology of diabetes, is a theory called the Omnius Octet theory, and one of them, no, not the Omnius, I've just forgotten what its name is, but one of the theories as towards the causative interactions in development of type 2 diabetes is infants who had a low birth weight. If they're exposed to, now if they're exposed to high to prolonged times of, so imagine somebody low birth weight, born into a family, it was a hassle, you know, that stuff, they really suffered, food was not really around. Then this person graduates from campus, gets this amazing job in the certain ministry, they're paying him millions of shillings, millions of dollars somewhere, begins eating anyhow. That person is going to put on weight so quickly. You understand? And that's basically the whole thing. When we deprive ourselves of calories for prolonged periods of time, weeks, on months, on years, we actually prime ourselves to scavenge. Even the little amount of food you get, your body stores it as fat to protect you, because our dear Lord did purpose that our bodies need to protect us. You understand? Now, and that's why for somebody, say, who goes on a fast for a month, they may lose a lot of weight, but they typically end up looking sick. Somebody says, you're looking too thin and that kind of thing. They have lost muscle. You understand? When the fast ends, if they start eating anyhow, they put that weight back on. You understand? And I've got people who come from when they've been doing juicing and they tell me, doctor, I put on that weight. I lost a lot of weight, yes. But when I started eating, because you can't survive on juices for the rest of your life. Trust me, it's not sustainable. When you start eating normal foods, you will put that weight back on. But another thing, the final thing, which happens to your body when you expose it to excessive long periods of calorie deficits, is that your body works like a company. So if a company is short on cash, it lays off staff, right? For your body, the staff is your muscle. You can survive if you're weak in your bed, but your heart is beating and your brain is functioning, your kidneys are functioning. You understand? So you having muscle and being energetic is not really all that important. So if you're not getting in enough calories, which are good, they are a source of energy. They're only bad when they're in excess. But if you're not getting in enough energy, energy is diverted for your vital organs. You understand? And therefore, you lose muscle mass. So you find someone is thin, upper body is thin, they lose muscle mass around your cheeks, because if you're not smiling, you will survive. For crying out loud. You shall survive, you understand? So you lose muscle mass. When you lose muscle mass, that also now makes you more likely to put on weight in the future. Why? Because when you eat, and as I said, you see this person who is lean, that kind of thing, and they eat whatever they want and they don't put on weight. The muscle is there to take up that glucose and those excess calories. But when you're thin, you find that you misbehave just once, and the next day you put on a kilo or even 1.5 kilos or something like that. So that's why I don't recommend juicing. And then to Grace's question, just to link it there, for this lady who is now pregnant, in some cases, the high intensity exercise can be associated with abortions and that kind of thing. You understand? Especially if you're doing heavy compound movements and that kind of thing. There are some people who can have that unfortunate incident. So I would not recommend. I mean, you can lift some weight, you understand? That's something I would really want to talk to that person, would want to tailor a program for them. But the basic principles are not so excessive intensity, you understand?
Yeah.
So lots of very high intensity exercise, compound movements which are involving like the whole body, you understand? So if you're doing some kind of squats and then some shoulder press kind of things, you're lifting very heavy weights, I would recommend back a little back on that weight. If your goal is fat loss, which I think it would be, you don't want to gain too much fat during your pregnancy, I would emphasize to that person to maximize the diet. We had a lady who lost 1 kilogram of fat in her pregnancy, but she delivered 1 kilogram of fat, not of weight. Again, that's why I said I want us to distinguish. For us, we hope you lose fat and keep your muscle. When you lose weight through juicing, you lose muscle. So that's losing weight. We do not do that. Why? Because the weight comes back. We want you to keep your weight off. So if your goal is losing fat, maximize the diet. And then focus on low duration cardio, just walking. The lady who I shared with you, who we're working with, who lost 9 kilograms in 6 weeks, she wasn't doing any high intensity exercise, just walking for 30 to 40 minutes, 3 to 5 times a week, and then resting on the other days. You understand? And she lost 9 kilos in 6 weeks just by doing the diet, basically. And she's not that fast. So I just want to get that thing out of our heads. We don't need to do excessive amounts of exercise. You can lose weight without doing excessive amounts of exercise. Just doing smart exercise, but maximizing diet and then stress relief, like sleep and that kind of thing. Yeah. Castro, we have hit the 1 hour mark. So I'm just going to ask us just to only handle, there are 2 questions here. Can we just do those only and that's it? Is that okay?
Yeah, sure. Yes.
All right. So I see here, I probably missed parts of this. However, could you talk about why it's seemingly difficult for someone with Pcos to lose weight? Okay, and the next question is, what are the early indicators that a person may have Pcos? Okay, Castro, could you just, I think you handled this, but maybe just briefly, just summarize that last one,
Yeah.
I think.
Okay, I think it was Agatha who asked.
Yeah.
Hi, Agatha. The early signs that someone may have PCOS are that they get menstrual irregularities, so they miss their periods when they're not pregnant. They get hair on the chin where they're not supposed to get, beards, mustache on the hands and on the legs, and they have to wax or shave every so often. The other sign is usually people struggle to get pregnant. So when they struggle to get pregnant, it could be an early indicator that someone has PCOS. Yeah, so those are the ones we do. The other one is having an ultrasound scan and you see many cysts on the ovary. Okay.
Yes. And then the question about why it's hard for somebody, why it's seemingly hard for somebody with PCOS to lose weight. It's not exactly, I wouldn't say it's hard. The reason why it's hard is because of the insulin resistance. The reason why someone would say it's hard is because of the insulin resistance. And this is something which I normally talk to people about. You see, weight loss, the first thing, if you live with no point regarding weight management, I want our guests to understand that weight loss is not only about calories in, calories out. If you seek to lose weight the healthy way, you need to first forget about that tracker, which is telling you that you've lost 1,000 calories. Yay! Losing 1,000 calories in 2 hours is very dangerous for you. You understand? On the meal plans, which I prescribe for most of the people, I'm never going to hit a calorie deficit in a day of 1,000 calories. Never. Because I know that your body is going to, one, your hunger cravings, the hormone ghrelin, your hunger hormone, is going to increase. It's going to become more active. It's going to stimulate hunger. You're going to prime yourself for scavenging. You understand? You're going to lose muscle mass, especially if you're a bit leaner. If you're a bit obese, you may not lose a lot of muscle mass because your body, if predominantly, is going to choose the fat. But typically over time, if you keep eating low amounts of food, and remember, the bigger you are, the more amount of food which you need to eat to sustain your body. Even if you're obese, you still need food to sustain your body. So I tell people, if you want to start eating less amounts of food, lose the weight. The more you lose the weight, the less amount of food you can eat. But until you do, you need, like, I'm 72 kilos, somebody, another guy who's 100 kilos, we can't eat the same amount of food. It's just out of the question. So there's the hormonal factor to it. It's not just about calories in, calories out. The hormones coming. And here the issue is insulin resistance. So what is insulin resistance? If I'm sensitive to insulin, which is the opposite, it means that when I eat food, when I eat a sweet potato, my muscles predominantly, my muscles are going to take up the higher amount of glucose from the blood, rather than it being stored, backing up into the blood and accumulating to raise my blood sugar, or getting stored in excess as fat. But when someone is insulin resistant, like our dear person with PCOS, what's going to happen is that this person is, since they're resistant, the muscles are not sensitive to insulin, which means the muscles are going to take up little or no amount of, okay, I wouldn't say no, but very little amount of that glucose. Most of it is going to pull up in blood sugar rises, and then the balance is going to be stored as fat. You understand? So that is why that's why somebody who has Pcos, somebody who is obese, would think that losing weight is hard. It's because to lose the weight, I tell people think that you need to lose weight to get healthy. I say no. You need to get healthy to lose weight to get healthy. So getting healthy means correct insulin resistance. If you're doing a weight loss program which is not correcting your insulin resistance, you're not doing yourself service on the long term. We want you to get healthy holistically. When you get healthy holistically, you're going to find it super easy to lose weight. If you improve insulin resistance, such that your muscles are taking up lots of that glucose, you're going to find it much easier to lose weight. So when you're insulin resistant, you need to first do things which improve insulin sensitivity. So somebody who's insulin resistant, if they cheat if you eat the wrong food even just in one meal, you feel the effect. But when you're insulin sensitive, so for example, I've had people, as I told you, like say if you're on a keto diet, you're not going to be eating carbs. The carbs you're going to be eating are just from vegetables, from your spinach, your broccoli, your cabbage, that kind of thing. But trust me, your energy levels when you've adapted to a keto diet are much better even than somebody who's on a normal diet. Your mental focus is superb. You understand? Because ketones are very good fuel for the brain, and ketones are produced in a keto diet. So what happens with these people is that sometimes these people come to me, like I had a client, he's on a keto diet. We actually did a testimony of his. I will just share his video in the description for you to watch it after. And this gentleman has been on a keto diet now for coming to 6 months. He's lost lots of weight. His pressures, he no longer uses his drugs. He's very active now. He's just so lean. Like you can see he's lean. Today he came to the gym. He's just left the gym. He's been doing pull-ups on the bar. You know, he's just a transformed person. But he told me, it was like, no, you know, doctor, my daughter's birthday is coming up, and there's going to be cake. I want to support my daughter. Can I have a piece of cake? And I've had a couple of people who have been on keto for quite a while, and they cheat, some for just one meal, some for a day. Then I tell them, come and do your measurements the next day or within the next 48 hours. And always, whenever they come in, they have increased muscle percentage and burnt more fat. Why? Because in the setting where you've been eating low carb diets, you know, diets which are not stimulating high insulin levels, you understand, your pancreas gets time to relax, the amount of insulin reduces, which is a good thing, such that you become insulin sensitive. Remember, less insulin, insulin sensitive. More insulin, insulin resistant. Bad. So they are now insulin sensitive. When they eat that carbohydrate, that high amount of carbohydrate, your body actually recognizes it as a good thing. It boosts metabolism. They burn fat, they build muscle. You understand? So fat loss is such an interesting topic that it goes beyond just the basic principles. So the person who has Pcos or who is insulin resistant, if you're obese and you're struggling to lose weight, you need to actually, I tell people, you need to take a moment for a certain amount of time. At least I tell people, how badly do you want to lose the fat? And if you're serious about losing the fat, I tell them, for a moment, I have seen the best results come when somebody sticks to the right kind of eating. For at least 8 weeks, yeah, you like get some benefit. 3 months, yeah, some good benefit. Wow, between 3 and 6 months, you're just in a different zone. You find that it's just so easy to lose the fat because you need to get healthy to lose fat to get healthy. We need to run away from any fad thing which is just talking about losing 20 kilos in 2 weeks. What is that? You understand? Like, what is that? You're not improving. You're just losing muscle mass, reducing your insulin sensitivity, increasing your insulin resistance. You're going to put on that weight. Yeah, you're going to put on that weight after. So that's why people with Pcos or insulin resistance may find it hard to lose weight. It's because many of them are failing to adhere to the right kind of eating. You understand? So, or maybe they adhere for too short a time. You understand? Trust me, adhering for a diet for 1 week, you're most likely going to lose half a kilo to, if you're really lucky, 1.5 kilos. But many people who are really insulin resistant, they only lose maybe one kilo, and then they get discouraged. That's just 1 week. So one thing I want to encourage people, even just as I finish this, I like using a principle of tithing the weight. At TIMNATH, we normally tell our clients, fine, you've come at 100 kilos. Your target weight to be healthy, to have a normal BMI, body mass index, your weight related to your height is say 65. Those are 35 kilos. That is a humongous target to tackle. We have people whose target is they need to lose 45 kilos. That's like crazy amount of weight. I tell people, tithe the weight. So if you are 120 kilos, let's tithe. Let's remove a tenth. Lose 12 kilos. You can lose, for somebody who's 120, if you devote, if you come and you're really serious and you devote to the right diet and you do exercise and you rest, you recover well, you can lose those 12 kilos. You can hit the 1.5 kilos per week and lose those kilos in 8 weeks, which is, we have an 8-week program, which helps people do that. You understand? If you're really slow, you could be at 8 kilos. But if you lose, remember we said if you lose 10% of your weight, it can help improve your insulin sensitivity. For someone who has Pcos, just 5% of that, maybe after a month, after 5 weeks, 6 weeks, you may find that you've gotten a period back. Now what you need to do is now continue. You understand? So if you're able to continue 8 weeks, you lose 12 kilos, your new weight becomes 108 kilos. Okay, let's lose another 10 kilos. That will take you another maybe 6 weeks, 8 weeks, 10 weeks. Then when you've gotten that, and trust me, just 10% weight loss, you will feel it. Your heart will be beating better, you'll feel more energetic, the clothes will be loose at your waist. So run away from schemes of 20 kilos in one month. It's not sustainable. The weight will come back. But if you lose it gradually, while improving your metabolism, while improving your insulin sensitivity, you'll be getting healthy to lose the fat, to keep losing fat, and then ultimately you will now reach your goal of 40 kilos. It may take you a year. You understand? Again, I'll link another video of one of our other clients, Disha. She lost 31 kilos, but over about one year and 3 months. But you know, she's been able to get her periods back and she's lost fat. She's now healthy, like she's managing the Pcos. You understand? She's managing the PCOS. Yeah, and she's living a full life. Yeah. Castro, I think we may never be able to finish, but our guests, Dr. Kisuule, I know we have your information in the description, but could you just tell us how the people can find Dr. Kisuule, how they can find Alexandra Medical Center? Yeah.
Okay, so thank you very much, Andrew. Castro is my name again, Dr. Kisuule. I am usually at Zambia Hospital and Alexandra Medical Center. Alexandra Medical Center is found on Yusuf Lule Road, Chitante Close, next to Humura Hotel, or very close to where CMI was. We are open every day of the week. Because of COVID, we are open 8 to 5 p.m. every day.
Yep. Every day, Monday, Sunday to
Sunday. All days of the week we are open. At all times we have a doctor, we have a lab, a pharmacy, and we are available to anyone who comes through.
Yeah, and for our guests, I think I've had lots of feedback from friends and from other people. I mean, you go there, if you're the kind of person who wants to be able to talk to a doctor and not just rush through and receive like kindness and that kind of thing, I think like Alexandra is an amazing place to go to. And their contacts are down there. Their website link is in our description. So check it out, check out their facility. And yeah, if you want to get tested and go in and do that. For me, Dr. Andrew Etuket, I'm the director here at TIMNATH Health. Run a metabolic clinic, help people lose fat, build muscle. We do meal plans for people based on locally available foods. Our promise is you will never be hungry when you're on our meal plans. We always tell our clients, if you get hungry, you're doing something wrong, call us and we shall help you. We do the meal plans. We also do exercise training on site and also some online. We also have some online programs for people who are interested in that. So, Castro, this was amazing. We shall definitely do this again. Remember, if you still have questions, leave them in the comment section. We will address them. If we need to come back, we will. If we need to do a separate video, we will do it. We will not leave you abandoned. All right, Castro, thank you very much. And
thank you very much for inviting us.
We need to do this again.
Yeah, sure.
All right.
Thank you.
Have a nice weekend, Castro. Have a nice weekend. Bye-bye.